When it comes to treating addictions, you use a lot of NAD to treat addiction. Can you tell me a bit about just, and the listeners a little
Yeah,
about what NAD is and how you got introduced to it?
sure. Yeah, great story. So I was just doing drug and alcohol treatment in San Luis and standard kind of medications, counseling. I wouldn't say we had any sort of novel approach or anything alternative or different. Then they had a patient, Toby, who said that he was going to go to Louisiana and do brain restoration therapy for his addiction. And of course, at that time, I'm just super skeptical. I'm just, thinking, yeah, whatever, go ahead, go do your fairy dust on your head and come back. Well, I followed up with this guy, at some point later, and he was great. He was doing fine. Like, really? Oh yeah, no, I'm off. No cravings. I've been sober for 6 months. And okay, well, now what is this called? Where did you go? And then I got curious. Like, okay, well, this is something might be here. So I found out about Richard Medier, who was in Springfield, Louisiana, at the Springfield Wellness Program. And I started talking to him, and I said, hey, well, how do I do this? He's like, well, you need to come out here and you need to learn how to do NAD. It's not like I'm just going to tell you in a minute on the phone. So I took my one vacation that year and I went down to Springfield. I think in the heat of the summer, if I remember right, it was like humid and nasty. I was like, oh my God. But what I saw really changed my life. I mean, I saw patients detoxing in their program off of alcohol, off of opiates, off of high dose opiates, who are doing amazing. Like, I had not seen that before. I'd never seen anybody, day 4, day 5, kicking methadone, who's relaxed, hanging out, reading a book, eating lunch, feeling fine. I mean, these patients are, shitting themselves in the corner, right? This is not a good experience. And these people are doing great. Well, I did a week there or so, and I just remember flying back to California and just having this vision. It's like, this is going to change the face of substance abuse recovery nationally. I mean, this is the new standard. What I saw NAD infusions do to reduce withdrawal and craving, I thought, I'm bringing this to the West Coast. This is unbelievable. So we started our NAD program back, I want to say around 2014. So what is that, 7 years ago maybe? And that's how we started with NAD. So so NAD is nicotinamide adenine dinucleotide. It is a vitamin. It's a coenzyme of the B vitamins, but you can't just take NAD by, you can't just increase your NAD by taking niacin, which is a big misconception. You can't do that. But anyway, if you give IV NAD, and people figured this out back in the 50s, there's articles back in the 50s where we knew that if you gave NAD to patients, and the original study actually came out of Seattle, that it reduced all cravings and withdrawal from people who are detoxing, and not just detoxing off alcohol, which is probably the most robust response, but barbiturates and stimulants and sedatives. And for some reason, I'm not sure, it fell out of favor. I think probably because methadone came into the picture and was much more profitable for centers. But we started our NAD program, and and that was pretty early. Now everybody's offering NAD, right? Every infusion clinic and wellness practice and IV therapy center in the mall. I mean, everybody will do NAD. Now, that's really for a wellness indication. They're just doing it for longevity and to feel good and to feel better. And it does do that. But it's a little bit more complicated for withdrawal and detox, but that's kind of our expertise, and that's been my interest. So now we still offer NAD. I think it actually ends up being kind of a small part of our program now. I think most of our substance abuse patients don't do NAD just because the time and the cost is kind of restrictive for a lot of people. But I love it, and I do it when I can. And I think those patients, turn around faster, have a better, they just get feeling better faster is really the way to explain it. When people ask you, like, well, explain what it is. What I say, Toby, is like, look, if you stopped using pain pills right now, okay, a year from now, you're going to be fine. Okay, your brain will recover and you'll be okay. But it's going to be a rough few months, right? There's acute withdrawal, which you know what that is. But then there's post-acute withdrawal, right? We're just fatigued and you don't have any energy and you have a lot of anxiety because your brain really hasn't started making that sort of neuroprotective soup, the normal amount of endorphins and enkephalins you need to feel good, right? To feel motivated, to get out of bed, to want to go do stuff, to hang out with your friends, to go work out, right? You need a certain amount of dopamine and endorphins in your system, which are not there, right? So, and that's why the relapse rate's so high, right? You take people, they'll go through detox, they'll get a week or two behind them, they feel like they've got this, but they feel horrible for months. They just depressed and anxious and don't want to do anything. And then they just take that one pill one time and boom, they feel great. It's right back where they started. And that's the cycle of addiction. Well, what NAD can get you feeling like that year, how you're going to be a year out, I can get you feeling like that, a month out with NAD. It really just provides this sort of rapid restoration. I wish I understood all of the molecular biology of how it works. I mean, I certainly can explain how NAD is involved in alcohol metabolism, because you can just Google alcohol metabolism, look at a picture, and you can see that you burn up all your NAD metabolizing alcohol. But any of this, all these substances really induce a lot of stress on your central nervous system that deplete your NAD. And NAD is just pivotally involved in over 400 systems: your immune function, your aging, your sleep, your stress response. I mean, everything is just dependent on your nervous system working optimally, and NAD is just such a core component of that. So when you deplete people of NAD, they're just really not doing well, right? Their cravings are high. And there's studies, and I can link to it, but there's studies now that show that if you give NAD, people have less cravings for drugs. So anyway, that was my interest in NAD, and I'm a big believer in NAD. I've become a little bit more selective, about the patients now over the years, as I've seen people do better on some things than others. But so that's kind of my experience with NAD. Is I found out about it from a patient who did it, and I just learned from them, and then got interested. And then as I've been in the space longer, I've actually, just connected with people all over the country now. On NAD, there's been 2 or 3 conferences nationally on NAD for practitioners of NAD. I think more people are familiar with it now. There's a nurse in Monterey who just has a wellness practice, and she does way more NAD than I do, but she's just giving it for wellness and anti-aging and, feel good and feel better and that kind of stuff. And she does 10 times more NAD than me. But we have people coming for longer programs to, detox off opiates, to detox off. When traditional therapy hasn't helped, I think there's a role for NAD. I love the alcohol response is my favorite. My alcohol patients, they always just respond really wonderfully and predictably to NAD. So that's probably my favorite patients to give NAD to. But there's a role for other things. And of course, we use it for neurocognitive impairment, neurocognitive decline, Parkinson's, Alzheimer's, real kind of mixed success. I don't try to overpromise it, but neuropathic pain, a lot of facial pain, migraines, there's been a role for NAD. Trigeminal neuralgia, we've had surprising results with that. Interstitial cystitis, just kind of like when your nervous system gets mixed messages, right? I mean, it just kind of gets the chronic improper, the chronic stimulation just kind of results in an improper signal generation if it's that stress response there's too long. So, there's been NAD used for regional pain syndromes and complex reflex sympathetic dystrophy. So it's really, I mean, the most simple way is it's just like a central nervous system mitochondrial tonic, right? It's just things, people report, wow, my vision's better, my hearing's better. Wow, okay, well, that's cool. That wasn't what you came in for, but that's good to know. So yeah, we love NAD, and for a while, that was really the majority of our practice. As we've kind of grown now into more of a wellness practice, it's not the biggest part of our practice anymore, but we still get a lot of NAD patients and a lot of interest in NAD. I just think we have a reputation now for really being knowledgeable about NAD. So, but as it's become more available and accessible, I think that people aren't really coming in from all over the country as much as they used to, because there are NAD providers now in their cities or their states that are probably closer, which I respect. I want to make it easy and as possible and as accessible as possible. So that's a little kind of a quickie on NAD and what it is and how I started using it.
Wasting my time.
You just can't help yourself, can you?